Hi, I'm Dr. Thomas Cordier from the New England Center for Cognitive Behavioral Therapy here in Glastonbury, Connecticut. What is I CBT? Well, I CBT is Interpersonal Cognitive Behavioral Therapy, a highly effective treatment system that includes the components of cognitive behavioral therapy, interpersonal therapy, behavioral parent training, and emotional intelligence. So what does I CBT address? Well, I CBT addresses a number of difficulties that children, teens, and adults struggle with, such as depression, attention deficit disorders, obsessive-compulsive disorder, post-traumatic stress syndrome, as well as an array of other disorders that people struggle with throughout life. So why does it work? Well, I CBT uses a psychoeducational process that includes a cognitive behavioral component. By helping patients to challenge their irrational thoughts, they begin to feel better, get better, and do better. So let me explain what an I CBT structural roadmap is. Patients utilize a structured workbook that I created in order to obtain optimal treatment success in a step-by-step process. The I CBT emotional intelligence component, or the interpersonal component, ensures that both patients and I CBT therapists create a strong relationship bond. Once trust and rapport is earned or established, patients begin to challenge their core beliefs. Core beliefs are the well-ingrained self-concepts that we form throughout life. These negative self-concepts are challenged with the I CBT therapist, and once this is achieved, the patient is ready for graduation from the Interpersonal Cognitive Behavioral Therapy Treatment Systems program. Well, any CBT teaches self-empowerment. It teaches people to be their own therapist, and once we can really take responsibility for ourselves and learn to help ourselves, we begin to lead happier, healthier lives, more well-adjusted, rational lives. And really the only way to do anything is to help yourself. For example, if you have back problems, you might go to physical therapy. And your doctor might say, in order to strengthen that cartilage between the vertebrae, you have to keep working the muscle around it to strengthen it. Well, what we do here is very similar. Through repetition, we're strengthening neurons or certain parts of the brain in order to control negative emotions and impulse. So there is a science behind this. And once we can achieve this, once we can control those negative emotions by changing our thinking and strengthening those neurons through repetition of our skills, we begin to feel better and get better.